Hi, I'm Dr. Rightmire, and I'm going to switch gears a little bit here. We're going to talk about something non-medical. Usually I've talked about sports medicine in previous years. I'm sure you've heard some of my talks before. So today we're going to talk about artificial intelligence, which is kind of a big raging topic in the past few months, and how it's going to affect the way we practice medicine. Specifically in this talk, I'm going to talk about how it affects private practice, which may be of interest to some of you in the room, may not, but something that is at least interesting. So you all know my background by now, I'm sure. I'm going to start with a preamble. So humans created the ability to make fire 400,000 years ago. And this is a recurring theme that I've started to see when I started to research this topic. By the way, I'm no expert in artificial intelligence, and I just drew the short end of the stick, I think, to do this talk. But it's a good analogy. The idea that fire was not created, but the ability to create it was developed, and we didn't understand how it worked. All we knew was that it burned and glowed and cooked, etc. And it changed the trajectory of civilization dramatically from that point on. So fast forward to about 3 months ago, we saw the rise of widespread publicly available artificial intelligence with the ChatGPT, or generative AI model, that is a large language model-based chatbot, which simply means that it is not domain specific. It's meant to ask it any question you want, and it will search the internet and come up with a thought-out, logical answer. So it was developed by OpenAI and launched on November 30th, 2022. The best definition I have of it is that it mimics the neural network of the human mind by creating context-based text. So it just studies language, learns from probability what words would come next, and puts together strings of sentences. And then by January 2023, it became the fastest growing consumer software application in history, gaining over 100 million users. So this exceeded anybody's expectation. It caught Google, Baidu, Meta, and even Microsoft off guard. They all scrambled to develop their own competing forms of ChatGPT, Bard, ErnieBot, and Llama. And then Microsoft launched Bing, which was special because it was the 4th version of the GPT language model. So through huge amounts of data and computing power, it's able to retain, adopt, and utilize the best ideas humans have, and it seems to be learning. So like fire, we don't really understand how this works. And that since its development and it's being unleashed on the world, whole fields of studies are being devoted to trying to understand how it works, how it heats, how it glows, how it cooks. So I'm going to focus on AI in healthcare. It's a huge topic, probably not something I could cover in 15 minutes, and specifically low-hanging fruit, transcription, obviously something that AI could take over pretty quickly. Right now we use virtual scribes, which is basically carrying around a laptop or even a phone with us in our pocket when we run through our office clinic, and someone on the other end of the line, a human being, types out the note and then puts it into our EMR, and we proofread it, and they learn our ways and means. So this is something that an AI entity could easily take over. So that's kind of the low-hanging fruit. Coding is a bigger one. This is where we could see the biggest gains quickly, because for reasons I'll explain, that is a vastly complicated part of our practice and something in the greatest need of reform. And then there's the diagnostics. You're hearing about doomsday stories of AI taking over pattern recognition tasks that it can do far more effectively than humans. It's going to replace radiologists and pathologists and cardiologists. Eric Johnson, if you're still here, sorry to break the news. But I think those scenarios are probably a little bit farther off than we think for several reasons. But one is that AI, or healthcare in general, is a field of industry that's slower to adopt technology than other industries for several reasons. One is it's harder to implement. There's a lot of complexities, a lot of privacy rules, a lot of formulations that we have to adhere to. It's also higher stakes. Making mistakes in healthcare has dire consequences, legal consequences. Everyone obviously wants to take good care of their patients. So for these low-hanging fruit and the other business side aspect of the implementation of AI, we're probably looking at about a 2 to 4 year implementation, but the drumbeat has begun. So starting with transcribing, again, I mentioned we do it now with scribes. We used to have a human, usually a medical student or someone who had some background in medical training who would literally walk around with us in the office on a computer with wheels like this, but with wheels on it, and transcribing. And that was a little invasive with the COVID pandemic. That also became problematic, so we switched to virtual scribes, and that's what the majority of us use now. Some of us use dragon recognition language software and things, but it's all cumbersome and problematic and expensive. So there's already technology being developed to capture natural conversation and identify relevant medical information through AI. And it's the same thing. You carry around a little app on your phone, and it listens into the conversations. It takes out the meaningful parts of the exam and the history and creates a SOAP note, your subjective, objective, and then assessment and plan. Structures a pre-filled note, a template, with the CPT codes, and then the physician just reviews it and signs off, similar to what we do now with scribes. But very accurate, already on the market. These appeared in November when the ChatGPT first began, started with a few subscribers. Now out in California, some of these companies have 200, 300,000 subscribers. So it's sweeping across the country. Seems to be a lot of this happening out west, as a lot of technologies do seem to germinate and then spread. Stanford, UC Davis has also developed an AI assistant that responds to patient emails. So it goes through your inbox, picks out all the patient emails, and then generates empathetic responses. At the end of the day, when the physician is tired and burned out and doesn't feel like answering emails, the AI can do it for you with the empathetic tone that is required and expected, and then all you have to do is review it and send it, and eventually these things could even be sent without reviews once you learn to trust it and it learns you, and so on. So coding is a big one. This is a big headache of ours, something we've been dealing with, and it seems to be getting worse and worse every year. The current insurance billing process is literally insane. So if you look at the expenditures, $500 billion a year is spent by practices like ours and hospitals and everyone else on billing and insurance-related administrative costs. That's 12% of what we spend, U.S. spends total on healthcare per year. No other country in the world does this, and it's a huge waste of money, and it keeps getting more and more complicated. So the reasons it's cumbersome is that it's manual. Human beings have to go through every step. It's highly complex, getting all the codes, and the list of codes gets bigger and bigger every year, more and more specific, and the software to try to match diagnoses with codes is not very effective. And the rules are always changing. The laws are changing, the insurance companies are changing, and it's very hard to keep up with. Mistakes are made. Anything that's human-driven is going to be prone to mistakes, and it's slow. So what it looks like right now is this big spaghetti diagram where the patient is up in the left corner and the provider's in the middle, surrounded by the billers, the insurance companies. They have a clearinghouse, the EMR, the EHR, electronic medical record, electronic health records, and all focusing on this claim that just bounces around everywhere. So on our end, we have a billing department that edits the notes that the provider provides with the scribe. It may be full of errors or not entirely consistent with the code that needs to be generated. So then they submit the code once it's edited, and then they create a claim. And this whole process takes days. Then it goes to the insurance company, and more it gets denied. And believe it or not, interestingly, insurance companies are already using AI to create these denials. So we're at a disadvantage right off the bat. We have human beings doing our grunt work with the editing, submitting, re-editing, resubmitting these claims, and around we go. And what this turns into is taking 120 days easily for the provider to get paid for a simple office visit or surgical procedure. What it should look like is this, just three entities: the patient, the provider, and the payer, the insurance company. But this is a pipe dream and will not be a reality for a long time. So how can artificial intelligence help? How can this contribute in any meaningful way? So it's already being used to automate denials. We know the insurance companies have bots that go through the claims and immediately flag any inconsistencies and automatically stamp it with a red denial and send it back to the provider. Eventually, it can become something that we can use to automate claims, authorizations, credentialing, collections, starting with that virtual AI scribe that generates the CPT code. It's not hard to then turn that into a claim, dotting all the I's and crossing all the T's and checking all the boxes in a way that's not deniable. And then it goes to the insurance, and we see something that looks like this. So now we have the payer and the provider at one end. A third entity, so you're actually throwing additional complexity into the system initially, but someone who provides the AI software. But what this can do is streamline, by automating on a big scale, what happens with the claims and how they turn from a patient visit to a CPT code or an E&M visit to a billable claim that then goes through the payer and back to the provider. These black box things are something that I kept coming across while I was reading about this stuff. And this goes back to the part of AI that we don't really understand. So we know that we can give an AI program that's specifically primed or tuned for a task, a bunch of data, tell it what to do, and out the other end comes our answer. And it on a very quick and rapid scale, and we don't really know what happens in the middle. But it works, and that's what these little black boxes mean. And it's just accepted by the industry right now that there's going to be parts of it that we don't understand, but it can be used very effectively without necessarily understanding it, like fire, for lack of a better explanation. So what this could turn into on the coding side of things is an artificial intelligence on the provider side versus an artificial intelligence on the payer side arms race, where it keeps going through the claim denial process, but just bigger guns and longer range missiles, which is worst case scenario. Or we could see the provider getting paid. Theoretically, it's possible they could get paid instantly. You walk out of a clinic office visit, patient is happy with their service or comes out of surgery, and the payment immediately goes into the payroll, or to the accounts receivable. That's the best case scenario, but theoretically possible. So I said I wasn't going to talk about diagnostics, but I have a minute or so left. So I came across this article in the Clinical Orthopedics and Related Research, which is an orthopedic journal, that some resident had decided to ask Chat GPT, just the generic version, the one that's available online through the AI website, a bunch of questions from the ABOS boards, the written boards to become a board-certified orthopedic surgeon. Gave it 400 randomly selected questions, and lo and behold, it got 47% of the questions correct on the first try. So that doesn't sound like a great grade, but it actually is equivalent to or better than 40% of first-year orthopedic residents. So it only got in the first percentile for fifth-year orthopedic residents. So yeah, that means that it would not have passed the official board, assuming that you needed a score better than 10th percentile to pass the board, which is the current standard. But that was on its first go-around. And if you look at these domain-specific artificial intelligence that, for example, you teach to play chess, it's doing random moves like a toddler in the morning. By midday, lunchtime, it's beating the average chess player, and by evening, it's beating the best grandmasters in the world. So it goes without saying that this thing could master the orthopedic boards and a couple of other go-arounds. So what are my conclusions based on this? It's happening very quickly. Newer versions are constantly coming out every day, it seems, with exponential growth and possibilities, not just in healthcare, but in a lot of aspects of our professional world and personal lives. I don't think it's going to replace providers just yet, but I think that it's the common sort of sentiment is that providers who use ChatGPT effectively in their practice and in their business and AI will replace the providers who don't. So resistance is futile. So any questions?